My name is Marko Korenjak, and I'm the current president of European Liver Patient Association, or ELPA. ELPA is made of 31 patient associations from 25 countries in Europe, and we are proudly partner in the project Decision that was founded under European Commission. So why is decompensated cirrhosis fatal? End-stage chronic liver disease, or cirrhosis, is the major cause of morbidity and mortality. 1.2 million deaths worldwide in 2013, and has a large socio-economic impact because of high healthcare costs and the patient's inability to work or seek employment. Patients show symptoms, they start suffering, and eventually they die of chronic liver cirrhosis when the body essentially cannot compensate the dysfunctional liver condition any longer. That is why this is called decompensated cirrhosis as opposed to compensated cirrhosis. Eventually, it progresses to acute on chronic liver failure, or ACLF, and death. Despite a vast array of available treatments for decompensated cirrhosis, 5% of the patients die by day 28, and even 14% of them die by the day of 90. Research suggests that individual differences between patients with regards to genetics, precipitating events, and treatment response as the main culprit for the high mortality rate. This also calls for a better patient-personalized treatment. So how will patients benefit from Decision? First, the patients participating in these clinical studies may directly already benefit from Decision research, while future patients with cirrhosis will hopefully benefit from novel combinatorial therapies and improved clinical guidelines delivered from the project's findings and results. Decision gives hope to patients regarding new and personalized treatments. Then, broader speaking, Decision is forging a pathway for patients to access new information to enable them to make informed decisions, but also starting advocacy and support actions of millions of people. This is the reason why they should have an easy access to crucial and updated scientific information. Last but not least, some time ago, it was not a common practice to have a patient association as a project partner. However, the results of research like Decision led to more breakthroughs, discoveries, and world firsts by taking great ideas from the lab to the market. Excellent science, competitive industry, and tackling social and economical challenges are at the heart of Project Decision, and these are also the milestones of improving healthcare for liver patients.